dental insurance is probably one of the biggest scams in America right now because these CEOs claim that they're looking out for patients. They claim that they're looking out for providers, but all they're doing is taking the money in between and are getting these $1 million plus paychecks every year for basically scamming both companies, dentists, and patients out of money.
In a sense, when it comes to dental insurance for most people, it's something you just sign up through from your employer, and then okay, I get 2 visits a year or X amount of visits a year, I get this much covered. But we tend to not think anything beyond the fact that, okay, as long as my visits are covered, I don't care what happens behind the scenes or what is happening behind the scenes. So would love to hear more about just generally behind the scenes how Big Tooth, I guess, is.
Yeah.
We'll just call it Big Tooth from now on.
Yeah, so big tooth. So let's talk about first how dental insurances work, right? So your employer signs up with a dental insurance company, okay? So this dental insurance company basically is a numbers game, right? So basically they'll say, hey, Zane, you have $1,000 a year from us. Use it towards whatever you like. Here's all the things that we cover at a certain percentage, right? So the way it works is they say that to you and your employer, right? Your employer and you pay a certain amount of money per month towards that dental insurance, right? And usually it's like what? Like a couple, 50, 60 bucks, whatever. And in your mind, okay, great, I'm paying, 20, 30, 40, 50 bucks a month, but I get my 2 cleanings a year covered and I get them paying towards whatever major work I have going on. So I'm going to come out on top. In reality, what's actually happening is they're taking that money, okay, and they're turning around to the dentist and being like, "Hey, look, I have Zane's whole employer, all of these people that work at their office. Now, if you go and network with us, meaning like, hey, you're okay with taking our discounted rate, I'm gonna put you on my website and say, hey, you're an in-network dentist with XYZ dental insurance company." And as a dentist, you're like, oh man, like I need marketing, I need people coming in my door. So let me go ahead and sign up and become an in-network provider for you, right? So now I signed up, and in the fine print, it's like, okay, great. So by accepting these patients from XYZ insurance company, for every cleaning, instead of I'm just gonna make up numbers here.
Yeah.
So just to keep it around, let's say your fee at the office is $100 for a cleaning. Okay. But by becoming a in-network provider and contracted with your insurance company, now you're okay with getting paid 50 bucks for the same cleaning. Okay. So in my mind, it's like, okay, great, whatever. Like I'm going to get all these people in and they'll maybe have work for me to do. So if I get paid half of what my normal fee is, that's okay because I'm going to get money through volume. And initially, back in the day when dental insurances first started up, this was great because for a lot of people, it's sort of like, oh, I only want to go to an in-network dentist who I want to see, blah, 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 blah. And patients were trained and kind of misled to being, hey, you can only go to an in-network provider, right? Those are the places where you have the best benefits. In reality, you can also be what's called an out-of-network provider, meaning that you're not in-network with the same dentist. So, for example, for cleanings and things like that, those are considered preventative visits, right? 90% of the time, regardless of your insurance, it's usually covered at 100%, okay? So being an out-of-network provider, right? So you come to me, I'm an out-of-network provider, right? So I'm like, hey, Zane, my cleaning's $100. You're still not paying anything out of pocket for your cleaning, right?
Right.
But your insurance company is now paying me $100 instead of paying me the 50 bucks that they're paying an in-network provider, right? And what that creates is for the in-network providers, they're thinking, oh man, like, hey, I'm going to get all these great patients in. And a lot of the time, yeah, great, you're doing a service. But what happens is you and your employer are paying these premiums for your dental insurance. They're not paying the dentist an appropriate amount of money. So who's really making the money in between? It's the middleman, right? So I think one of the biggest dental insurance companies, I think they cover maybe 20 or 30% of the US population. That's how popular they are. And they cover that many people. So they're like, oh, hey, look, we have this many millions of patients. And if you accept us as an in-network provider, we're going to send all these patients to you as an in-network provider, right? But at a certain point, like some patients, don't care and they'd rather be with a better provider, right?
Right.
But at least initially, a lot of dentists sign up for these insurances, not really realizing they're kind of shooting themselves in the foot. Because guess what? If you're a part of this dental network, right, there might be 500 dentists on this list. So how are they going to find you anyway?
Right.
Right? So then it comes down to other forms of marketing in the first place. So even though you signed up for these reduced fees, you're still kind of screwed because the patient still has to wade through 500, 1,000 dentists on their, dental insurance website to try to find you, right?
Right.
On top of that, dental insurance reimbursement rates are actually going down rather than up to adjust for inflation. So in the 1980s, most people still had, oh, hey, you have $1,000 a year, you have $2,000 a year towards your dental insurance, right? So imagine $1980 versus $2023, how much inflation is taking place. But guess what? We're still seeing people having $1,500, $1,000, $2,000 to spend towards their dental care, even though between inflation, cost of supplies, cost of labor, everything has gone through the roof. So who gets stuck in the middle and gets squeezed? The dentist. And so then here's where the other big tooth player comes in, the dental service organizations, okay? So DSOs, as they're called, are corporate entities that own dental offices, right? So you might be wondering like, oh, hey, like if dentists are struggling to cover their overhead and, deal with these crappy dental reimbursement rates, how are these corporations coming in and even making money, okay?
Right.
So the way they do it is scale, right? So they're coming in like, hey, I think some of the bigger DSOs, they own 1,000, 1,500 offices. So, right? So then this big tooth A, aka the DSOs, then approach the dental insurance companies. And they're like, hey, look, we have 1,000 offices. We have trained our dentists to have better outcomes. So in turn, you should pay us more because we have everything streamlined. We have everything ready to go. We know that if you send your patients to us, we're going to give them the best possible care. Is that true? Who knows, right? But they have enough leverage then to negotiate with those dental insurance companies and be like, hey, we want to get paid more if you want us to stay in network. Because guess what? It is somewhat of a symbiotic relationship. Because guess what? If this 1,000 office place decides, hey, you know what? We're no longer taking this insurance, that's thousands of patients that then, may or may not want to keep that insurance company for the next year, right? So it's sort of like you have to have enough leverage to, kind of argue with the insurance company. But what that does is it squeezes who? The little people, aka the private practice owners and also the patients, right?
Yeah,
because now
they have
it's
less
one
selection for care.
They'll have less selection for care. You're choosing one corporate entity over another, right? And the idea is the person getting squeezed the most are the individual dentists, right? So now you have a corporate entity that owns these dental practices. So rather than the dentist having autonomy to decide what procedures get done, what things get done to their best ability, they're not thinking from a financial standpoint like, okay, hey, excuse me, here's my reimbursement rate for this procedure.
Yeah.
What do I want to do today, right? Because most dentists get paid on commission, especially at these corporate offices. So it's sort of like, okay, hey, Zain walks through my door. This patient has this insurance company and I'm going to know I'm getting paid this much. There's some, like, I used to take insurances and I would get like paid $25 for a filling. Could you imagine? $25. And from that, you still get paid a percentage. So I went through undergrad, I went through grad school, and then I'm getting paid basically minimum wage, more or less.
Wow.
Right?
Yeah.
So a lot of providers are getting kind of squished on both sides. And so, again, I'm making the minimum wage argument because the other aspect of this, and again, I'm getting to the weeds here a little bit, but basically these dental service organizations and the insurance companies are sponsoring more dental schools. And you might wonder why? Why are they paying for more dentists to be created, right? They're basically saturating the market. So it's a supply and demand thing. A few years back, there weren't enough dentists. So guess what? Dentists were demanding higher salaries. They were negotiating with these insurance companies to raise their reimbursements. They were asking these dental service organizations for more money to get paid for the services that they do, right? If you have an oversaturated market of dentists who are desperate to seek jobs out, then guess what? Wages go down, reimbursements go down. Because guess what? If there's too many dentists everywhere, right? Mm-hmm. Patients now can choose whoever they want to go to because there's just a dentist on every block, right? And we're starting to see that a little bit, right? And so it's sort of like, what's more differentiating then? Is a dentist or is a patient going to go to somebody that's in network or out of network, right? A patient that's not educated is going to be like, oh, I just want to go to an in-network dentist. Let me just go to this person. And if you choose to go out of network, they're like, okay, I'm going to just jump ship and go to this person, right? The kind of crazy thing is the other aspect of this is dental school is very, very expensive. So you have these young people coming out of dental school with a high student debt ratio, right? Coming out and not finding any jobs in private practices anywhere. So if they can't find a job in private practice, who's going to hire them? Corporate dentistry, right? Hey, we'll come pay you. We'll pay you this much. Come work for us. We'll train you. We'll do all this stuff, right? I fell into that trap myself. I worked for a corporate dental office my first year because, again, I was like, okay, hey, this is a great opportunity for me fresh out of school. And then you quickly realize that is not patient-focused. It's very much profit-focused. I think the mission statement was, we're here to provide for our patients and to provide for our team and to provide for our shareholders or stakeholders. That's what term they used. And if you realize private equity owns a lot of these firms or a lot of these practices. So I remember when we weren't performing the way we wanted to, they would turn it on to me like, oh, hey, why aren't you selling more dentistry? These are the opportunities that you had to sell more and do more. And I felt kind of weird. I'm like, okay, I'm not a salesperson. I'm a dentist. Yeah. I'm here to take care of people. I'm here. This is not what I signed up for, right? I signed up to do good dentistry, to take care of people, to be ethical about the type of work that I do, and not necessarily try to squeeze every dollar out of somebody for their dental work. And again, this is why dentists have such a bad rep. This is why dentists have a bad name, because dentists are starting, especially at these corporate offices, are starting to kind of get squeezed and have their backs against the wall. So they try to find every issue possible because you never know if someone's going to walk through your door again.